Reverend Charlotte Bear, pastor of Cambrian Park United Methodist Church. I'm a mother of a beautiful 9-year-old special needs boy and wife to a hospice chaplain. I'm someone who takes my health, nutrition, and fitness pretty seriously. You know, I'm one of those preventive care people. And I'm actually what health insurance companies call a low benefits utilizing patient, because I hardly ever submit a claim. I just keep paying into the premiums, and I help, support everybody else's pool, and they never need to give me benefits. Except 18 years ago, I really needed benefits badly, and I was denied them. This is what happened. It was a different experience for me, too. I just have to back up and say, I'd gone to high school in Scotland, which is a government healthcare socialized system, a single-party system. And if somebody got sick, or you needed a leave of absence, or you needed prescriptions for your kids, you just got them. You just went and got them. Wow. Never occurred to me you couldn't. It was a basic right? And then I went to college and we paid into cheap health insurance. Nobody thought about it. And then I went into the service, and in the Army we kind of had a socialized medicine. If you needed help, you just went and got it. What? So this was my first experience suddenly where I had, 18 years ago, I had employer-based health insurance coverage. Now, I couldn't quite wrap my mind around that because I didn't know how somehow the burden of providing health care got passed on to my employer when it's supposed to be like a basic right. But anyway, I was told this is a good thing. Managed care is your friend. It's going to be a good gatekeeper and reform the system. And all you got to pay are deductibles and co-pays, and it's good. So my employer was paying my monthly premiums. Well, I went for my annual women's exams, those pap smears, ladies, those things you love. And for the first time in my life, I had a positive pap smear test. Well, we didn't know anything about the HPV virus back then, how that's an indicator of cervical cancer. And here I was, a young woman, never pregnant, not married. So I was low risk, lowest sort of concern level. And my doctor said at the time, just come back a year from now, we'll check you again, could be anything. I came back a year later on time, I had a second positive pap smear. My doctor calls me and says, egads, you have now gone from the lowest level of risk to the highest level of risk. I think you have aggressively developing, potentially fatal cervical cancer. We need to get you in here now. Now, I don't know if any of you, I know some of you, have faced that kind of pronouncement in your life. It's one of the most terrifying things you can face, isn't it? And I'm like, yeah, I'm there, whatever, let's go. And so I get in there, and she starts submitting authorizations for further tests and treatments to my employer-based health insurance, and they deny it. And she goes, what? Why? And they say, pre-existing condition. She had a positive pap smear last year. And my doctor says, what? She's probably got cervical cancer. They said, oh no, that's a diagnosis of suspicion of cervical cancer, which is the same thing that could have been said last year, pre-existing condition. We can't do anything about it. If she comes back next year, a year from now, she can submit claims for a bona fide cervical cancer diagnosis and get coverage. And my doctor says, you gotta be kidding me. At the rate this thing is developing, this gal could be dead in a year. She needs treatment and coverage now. They said, there's nothing we can do. And there was nothing my doctor could do, and there was nothing my employer could do. So I was faced not only with a very terrifying medical condition at a young age, but a financially devastating one. So, I said, well, okay, I'm going for the tests, right? What are you gonna do? And I paid out of pocket. I don't know about you, but back in the day, to go into a specialist's office was $400 to $500 a pop. Colposcopies, biopsies, MRIs, sonograms, these things are thousands of dollars a piece, right? I'm paying out of my discretionary income. I'm racking up a $20,000 credit card debt 18 years ago, and I never had credit debt. And after 8 months, I ran out of money. So I had a choice. Suspend treatment, take a leap of faith, or face medical bankruptcy. What I learned in that year is that when you have a third-party payer driving the system, they're going to make sure they don't lose. In the managed care system, I was disposable. It couldn't have been made clearer to me. I was disposable. The bottom line was not my well-being. And the people who were supposed to be watching my back when I needed it were the ones denying me coverage. And there was nothing anybody who cared about me could do about it. And the worst thing was that I was made to feel ashamed of myself because I didn't have the means to pay. And I had to go begging for my life. And I was made to feel as if I were the problem. Folks, 18 years later now, as a pastor, patient advocate, I have served, ministered to so many individuals and families, good, hardworking people who are made to feel like they're the problem for something basic. And I have to say, Lord, oh, how long, Lord, are we going to let this go on? I stand before you today as a survivor of cervical cancer, and that is by the grace of God, not because of the health insurance industry. Thank you.